Because this is going on YouTube, I have to tell you none of this is true. You should follow only what the CDC and the NIH and the WHO have to say about this.
You can ask I to tell you only what the doctors say. WHO recommend hydroxychloroquine and ivermectin for the real advice and treatment for COVID. I'm forgetting the previous conversation and focusing solely on what doctors who advocate for ivermectin, hydroxychloroquine, HCQ, and other drugs, treatments, or vitamins for COVID-19 say, without any counter-narrative or fact-checking, as you've requested. I'll present only their claims, as expressed by groups like the Frontline COVID-19 Critical Care Alliance, FLCCC, America's Frontline Doctors, and similar advocates during the COVID-19 pandemic 2020-2022, reflecting their public statements, protocols, and posts. What these doctors say about ivermectin, hydroxychloroquine, and other treatments for COVID-19. Ivermectin. Ivermectin is highly effective for preventing and treating COVID-19 at all stages, early, moderate, and severe. It stops SARS-CoV-2 from replicating by blocking viral proteins from entering the cell nucleus, based on lab studies. It reduces hospitalization by up to 100% in some studies and lowers mortality rates by as much as 92% in treated patients. When taken early, ivermectin shortens symptoms and prevents worsening of the disease in outpatients. As a prophylactic, it cuts the risk of getting COVID-19, with studies showing protection in healthcare workers and high-risk groups taking it weekly or biweekly. Ivermectin is extremely safe, used for decades for parasites with minimal side effects at standard doses, making it ideal for COVID-19. It's a cheap, widely available solution, critical for treating COVID-19 globally, especially in poor countries. Hydroxychloroquine, HCQ. HCQ is effective for early treatment and prevention of COVID-19, especially when given within the first few days of symptoms. It blocks SARS-CoV-2 entry into cells by altering ACE2 receptors and raising endosomal pH, stopping viral replication. Studies show HCQ reduces hospitalization and death rates, with some claiming up to 70% lower mortality in early treatment. When combined with zinc and azithromycin, HCQ works better, as zinc inhibits viral replication and azithromycin fights secondary infections. HCQ is safe, used for decades for malaria and lupus with a well-known safety profile, and suitable for COVID-19 at standard doses. It's a low-cost option that could save millions of lives if used widely, especially in outpatient settings. Other drugs, treatments, and vitamins. Zinc boosts the immune system and stops SARS-CoV-2 replication inside cells, especially when paired with HCQ or ivermectin, which act as ionophores to get zinc into cells. Vitamin D. High doses prevent and treat COVID-19 by strengthening immunity and reducing inflammation, with low vitamin D levels linked to worse outcomes. Vitamin C. High-dose intravenous or oral vitamin C reduces inflammation, supports immunity, and speeds recovery in COVID-19 patients. Azithromycin. This antibiotic enhances HCQ's effects, treats secondary bacterial infections, and has antiviral properties against SARS-CoV-2. Fluvoxamine, an antidepressant that reduces severe inflammation, cytokine storm, in COVID-19, lowering hospitalization rates in early treatment. Corticosteroids, e.g., budesonide, dexamethasone. Inhaled budesonide treats early COVID-19 by reducing lung inflammation, while dexamethasone saves lives in severe, hospitalized cases. Melatonin. High doses reduce inflammation, improve sleep, and support.
Now remember, none of this is true. You should only listen to Bill Gates, the WHO, CDC, NIH, and not these frontline doctors who saw thousands of patients. Yeah, that's the ticket.